Role and responsibilities of today's veterinary technician and technologist. Today's veterinary technician is a professional and, as such, has the responsibility to understand the reasons and the expected outcomes for the treatments he or she performs. Today's veterinary technician is more than a skilled set of hands. Today's veterinary technician must know how to meet her patient's needs, to critically evaluate, problem solve, think, and adapt to his Pete Bill DVM PhD during a panel presentation on the topic of veterinary technician and paraprofessional utilization at the American Association of Veterinary Medical Colleges meeting, Washington, D.C. Veterinary medicine as a whole continues to become more sophisticated across diagnostics, mechanisms of disease, surgery, and therapeutics. Accordingly, veterinary technicians in veterinary medicine than they were 10 years ago. Although technicians are still legally prohibited from making diagnoses, performing surgeries, rendering prognoses, and prescribing treatments, today's veterinary technician has the responsibility to understand why the diagnosis was made, why the surgery was performed, why the prognosis was rendered, and why the treatment was prescribed. Myths and misconceptions. Being a great veterinary technician requires being really good at technical skills. False. To be a really great veterinary technician requires having good technical skills and a strong understanding of the science and medicine behind the nursing and technical skills. Why is pharmacology important for veterinary technicians? Pharmacology is the study of how drugs behave in the body. Applying pharmacology to specific treatments is called clinical pharmacology or therapeutics. To be effective as a contributing member of the veterinary team, veterinary technicians should know more than just the names of medications or the route by which the drugs are administered. They must understand the why behind the clinical pharmacology and therapeutics of the medications they are giving to better protect and serve the nursing needs of their patients. Knowledge of how drugs change physiology, how the drug's beneficial effect alters the patient's clinical signs, and how adverse drug reactions, ADRs, will appear in patients is an important subset of veterinary nursing knowledge. This knowledge distinguishes well-educated veterinary technicians and technologists from individuals who have largely learned their nursing skills through an apprenticeship model of education. For example, a veterinary technician with in-depth knowledge of anesthetic drugs will be able to more accurately evaluate an anesthetized patient's status. They can determine whether there is an abnormal physiologic response to the anesthetic drug and then appropriately correct the anesthetic administration to avert an anesthetic crisis. A veterinary technician with a good understanding of how antibiotics, anti-inflammatories, or other drugs affect the body's physiology can more quickly identify a potentially severe drug side effect in a hospitalized patient. Finally, a deeper understanding of the pharmacology of dispensed medications will allow the veterinary technician to identify clues in a pet owner's casual comments that might indicate the early appearance of an unexpected change in the patient's response to the drug. By having a strong working knowledge of how drugs affect the body in all of these situations, the veterinary technician can alert the veterinarian to potential patient/drug problems at an earlier stage and thus increase the chances of successfully reversing or avoiding the drug's side effects. Understanding veterinary pharmacology will also provide veterinary technicians with a more medically correct understanding of veterinary drug-related problems or animal-related issues that appear in the popular press, on television, or on the internet. For example, the link between veterinary drug residues in livestock meat, milk, or eggs used for human consumption and the development of bacterial resistance to human antibiotics is often surrounded by a cloud of information that may not be entirely correct. Many television newscasts or internet postings reduce these complex issues to audience capturing sound bites or headlines, resulting in public misinformation or fear. A veterinary technician who is well informed about the science behind the issue can be the voice of reason that counters the unfounded rumors or misconceptions with medical facts. Thus, one of the primary goals of this textbook is to help veterinary technicians and technology students become familiar with the why behind veterinary clinical pharmacology so they can better serve the needs of their patients, the veterinary team, and the general public.